Okay, so this is a small introduction about how I got involved in working with digital applications. Well, I started as an MS nurse in 2010 with two neurologists who are deeply involved with clinical research. And one of these neurologists actually is focusing on artificial intelligence in MS. And through this collaboration, I actually got, involved on the sideline with this research, but I do not have any knowledge about artificial intelligence and even not about digitalization in care or even in MS care. I graduated as a nurse in 1994, and well, computers weren't very often seen in the hospital at that moment, so it gradually evolved during the years. So I had to learn a lot by myself in digitalization. And I often noticed, or maybe it was kind of more like a feeling, that I wasn't entirely in the loop the entire time. So by getting involved in this research, I noticed that in this research group, I was like the one who was asking very maybe naive questions, but they seem to be very relevant in this research. So I noticed that companies developing digital tools or digital applications were attempting to consult end users, but they were mostly consulting patients that were like tech savvy, and they had really good knowledge in using digital applications for their MS. You can go to the next slide, please. So a bit of theory. Since the 90s, there has been some digitalization in care going on. There's no specific date, I think, to pinpoint the first attempt. So it gradually grew since the 90s. And we use digitalization for our medical records, for generating results and analysis, but also for our as a form of communication. You can go to the next slide. So it ranges from electronic documentation to even robot-assisted procedures within our hospital. I think like neurosurgeons are very happy about using them. Next slide, please. So digitalization serves a lot of purposes. It can enhance or increase the quality of care and patient safety, better patient outcomes. It increases our efficiency and also our cost effectiveness. Next slide. It seems to be a solution for a lot of current issues in care, like the shortage of skilled professionals. Next slide. And a reduction in our administrative workload. Oh, there seems to be an issue to see the slides. No?
No? Okay.
No, okay.
So can you see the slide or not?
I can see them.
Yeah.
I think it was just the one
okay.
person. Okay. So digitized documentation, as I was saying, is used to reduce our paperwork and to create optimized schedules, to increase productivity, because we need to be productive, and normally we should have more time to care for our patients. So it seems like digitalization is offering a lot of solutions for issues in healthcare, but I'm just wondering if this is how you experience it, because personally, I feel there's a big discrepancy between optimally using digital tools and my own knowledge. So where do I find the exact information. I think that Noreen has offered already a lot of insight on where to find good information. And it seems to be taken for granted that as a nurse, you have the skills to explore digitalization or digital tools and to use them in your daily practice. Next slide. Well, a second use of digital tools is teleconsultation, which we were a bit forced to use during COVID, but it seems to be a trend that continues. It's a qualitative study of the experiences of patients with gynecological cancer by scores that concluded that the use of e-health in active cancer care and survivorship is also increasing. So it provides a way to tailor information and ease communication with healthcare professionals. And it should support empowerment and self-management. It also generates a high satisfaction among patients. Next slide. So there are a few conditions we need for adopting digital applications that is also applicable for patients as for us as nurses. Engagement can be translated as adherence, so the quantification of the effective use that can be determined by certain factors like user friendliness or passive data tracking and tutorials how to use it, and the motivation to use. So does it make my job any easier? Next slide. What are you using? For me, my daily practice, I use websites, I use applications, smartphone applications, and I use websites. And next slide. Why are you using it? Do you use it for researching information, for data collecting, or for forms of communication? Next slide. So in practice in Belgium, we have, as a healthcare professional, we have medical records. We can use them within the hospital. So there's, in the same hospital, access to the entire medical file from all specialties within the hospital, except extremely confidential information like genetic analysis or psychiatrical reports. There is also medical records that can be shared in between hospitals if the same platform is used. And between healthcare profession in Belgium, there is the e-health platform in which all results can be shared with explicit agreement of the patient. There's also mandatory information that can be shared, like vaccination status or a blood type. There's also the directive for organ donation that can be accessed in emergency situations, and information regarding social security, like reimbursement status or physiotherapy. But access is limited and based on function, like on the ER, or there is also difference between access between doctors, nurses, and paramedicals. Next slide. So for our own information searching, I just looked at a few websites and databases that I use in my daily practice. For guidelines, I use the ICH guideline website. There's also a very good website, which is unfortunately only in Dutch, which is a Richtlijnen database. That was made in the Netherlands. Evidence-based practice as a website I use UpToDate regularly, which is very nice to use. And of course, there's also the website for from the National MS Society. Next slide. For assessments, there is also the Dutch website. Unfortunately, only in Dutch available is Meetinstrumenten in de Zorg, where you can find like a database of all possible frequently used assessment instruments. That is, I think, not only for MS, but it can be general medicine. But there's a lot of assessments that we use in our daily practice as MS nurses. And there's also the HAPI database from Wolters Kluwers or IEP's co-host. Nursing guidelines, I found Nurses Labs, which isn't a website I use regularly. For nursing diagnosis, there's of course the Carpenito that isn't digitized, I think, until now. Yes, next slide. Digital apps. I use the first one is the immunology app. I don't know if it's very clear for you. It's just the Dutch version, and I don't know if in how many languages it's available, but it's an application that is made by Biogen that actually explains in a nice visual way the mode of action of the immune system, but also modes of actions from different kinds of treatments. I was also very happy to find that UpToDate has also an application. I didn't use it until now, but UpToDate is really a website I use a lot to find a lot of information. Then there's also this application that was recently developed by Janssen Pharmaceutics, which offers an assessment to do with your patient on how he's coping with his disease. And it also gives you a tool to adjust your information on how in which state he is, in which stadium he's actually in accepting his disease. The next slide. There's also podcasts. I don't use them very often, but we had, I think in November, a meeting with our Dutch colleagues. They had this very, very nice podcast about living with MS, which is called MS Keukentafel, but unfortunately only in Dutch. Next slide. Then what I wondered is in communicating with your patients, do you use the regular apps like Messenger or WhatsApp or Teams? They don't seem to be very safe to use in case you really share some medical information. Next slide. I think Noreen already gave us a lot of possibilities for ways to refer our patients to find the best information on their disease. Normally, I always refer to the official website or information platforms that are provided by support groups, local support groups, or like EMSP. There's a lot of misinformation that can be found on the internet, and it's not always so easy to guide your patients within this overload of information. So I always ask them to check if they read anything and they have questions about it, just to reach out and to check if what they read is correct. Next slide. I searched a bit through applications that were available for free and with which I had a bit of experience. So there's the Breezy app and the Clio app that are used for managing the disease. There's also MS Focus Radio, which is the yellow cross in the green circle that you can see, that is used for, it's like an online radio application about MS. I just put one example of a symptom management application, which is called MS Energize, because there's really a whole lot of possibilities to use for symptom management specialized in MS. I actually performed a recent scoping review about digital applications for fatigue in MS. And what actually I noticed is that there was a lot of pilot studies or feasibility studies with these applications, but there was no official official publications about this kind of research. So there was no evidence on a larger scale. So I suppose there's still a lot of research going on, or something happened with this kind of research. I don't know. So I'm hoping to gather a bit more information in the future. Next slide. Okay. So the podcasts, but I think these are already examples that Noreen showed us. There is one application that I want to give a small shout out to. I think that it is available right now, well, in Belgium, in Italy, and in the US, which is kind of complete. It really covers an entire range of possibilities for patients to monitor their disease. So it's like monitoring their symptoms. They can also upload their MRI images, but they don't get to see the protocol. So it's just the imaging, and then there is some general information about what they are seeing on this MRI, but it's no personal information actually. So it's just like general, what are black holes and what are lesions and what is contrast captation. There's also a smartphone cognitive assessments that can be comparable to like SDMT. A lot of PROs about EDSS and fatigue. There's also a way to communicate with your healthcare professionals. So all the monitoring, the symptom monitoring that they do, there's a way to connect with your healthcare professional and he or her can also see what has been introduced. And there's also the possibility to prepare the consultation with your healthcare practitioner. Next slide. So, however, I noticed that in doing this, I am conducting actually a small research about the use of digital applications with my patients, because the evidence showed that there is not a lot of continuity in using digital apps. So you can see that in several reviews, it was mentioned that there's a lot of dropout in research with digital applications, that there's not a lot of engagement or uptake. Next slide. So, well, it can be generalized for chronic diseases, but my research scope was focused on multiple sclerosis, of course. So the question is, why is this the case? Is it because there isn't any direct benefits for the patient in using it? We use it, or we present it to our patient as a kind of data collecting tool, but does the patient have a direct benefit? Are they scared of the confrontation with the disease, with having to use it every other few days? Is it time consuming? Are they physically able to do it? Is it because of they are concerned about their privacy? What about their level of e-health literacy? Do they have previous experiences that weren't very positive, or is it due to technical issues? So this is kind of the cross-sectional research that I'm conducting right now within my patients, trying to look for an answer on these questions. Next slide. So that's what I was saying. Here comes the MS nurse. So I think that in the entire process of developing, we have a role of asking the right questions. Why isn't it used? There seems to be something that is not working as it should. The next slide. So something is missing. How do we connect? I am a firm believer that digital technology has its use in MS care and in all chronic conditions, but somehow there seems to be something that is missing. And as a nurse, I think we should keep on looking for the missing link between developers and end users.